Hello, everyone. I'm Wendy Fournier with the National Autism Association, and I'm here today to speak with Dr. Sylvia Fogel, who is the mom of a son with autism and also the new chairperson of the Interagency Autism Coordinating Committee at NIMH. We'll definitely explain all of that to you. What is IAC? What can it do for the autism community? And with Dr. Fogel in charge, what she's hoping will come to pass during her tenure there as the chairperson. So we have World Autism Day on April 2nd, and we wanted to put this together to give everyone a sense of where we're at with autism research, services, treatment, and what we're hoping for in the coming years. Sort of a state of the union for 2026 on autism and what's important to all of you. So, Dr. Fogel, thank you so much for being with us today and
I
spending
am
some time
so happy
chatting.
to be here.
We're happy to have you. There's so much happening right now with autism. It's an exciting time. It's getting a lot of attention as it should. We sort of had a dip where autism it was a very big deal back in the early 2000s. There were a lot of national organizations that were bringing attention to it. The Interagency Autism Coordinating Committee was putting a lot of effort into addressing autism, causes of autism, research. We got the Combating Autism Act passed in 2006, which was a very big task that the autism community came together, worked very hard on, and was able to get some very significant funding for autism. And now, 20 years later, I want to talk to you about what the results of that have been. What is the state of autism now compared to the state of autism 20 years ago? And let me just say for everybody watching that Dr. Fogel is not only a mother of a son with autism, she is a leading advocate across the country. She is a medical doctor and instructor in psychiatry at Harvard Medical School, along with being the current chairperson of IACC. So I can't think of a better person to ask these questions to. So what do you think, Dr. Fogel, about where we've come, where we were and where we are now 20 years later?
Yeah, it's a great question. Well, on the bright side, I think that the past 20 years have led to a number of advances in our understanding of autism via concerted efforts in research. So we've identified a number of genetic risk factors. We have a lot of data showing that individuals with autism have higher risks for mitochondrial dysfunction. So those are the energy producing organelles inside of cells that not only produce energy for the cell, but also communicate within the cell and interestingly, between cells. So we have data that there's mitochondrial dysfunction. We have data that there's oxidative stress at the cellular level. So cells aren't able to kind of regroup and rebalance as quickly as they should be able to. We have really important data showing that individuals with autism have higher risks for having immune dysfunction and immune dysregulation. We know that there are increased rates of gastrointestinal disorders in individuals with autism, seizures, and very, I think, exciting research around microbiome differences in autism. I think where we've fallen short is that we haven't really been able to translate all of that knowledge into treatments. And it's at that translation step where I feel like people have kind of maybe not made that a priority. And it's one thing to do research for knowledge's sake, right? For the advancement of knowledge. It's another thing to have a razor sharp focus on the translation of that research into both treatments for people with autism, including for disabling core symptoms of autism, alongside co-occurring medical conditions in autism. And we certainly have had almost no progress in terms of prevention, which is, sort of a core statutory aim in the Autism Cares Act of 2024 and has been in prior versions of that bill. So I think, One of my hopes as chair of the new Interagency Autism Coordinating Committee, the IACC, is to really bring a razor-sharp focus on translation of existing research into treatments. And I'd love to, talk more about how to do that.
Yeah. I think that when we talk about things like mitochondrial dysfunction, gastrointestinal issues are so huge with our kids. These are things that we have been talking about for many, many years. And yet, as far as I know, when kids are diagnosed by a developmental pediatrician, that diagnosis is still based on observation of behaviors. And biomarkers like that are not looked for. And even kids who present with very severe GI issues aren't, as what I'm hearing and have heard for years from parents, those those symptoms are not being treated. Some parents even say that they're told that that's just part of autism. So how do we get to the point where part of the diagnosis includes looking for the more common biomarkers that we already are aware of and know that we can treat and help these kids feel better and function better? How do we get to that point?
I think there are probably several avenues to get to that point. I think we need more education for providers and not only developmental pediatricians, but regular pediatricians in the community. When someone has an autism diagnosis, they should be screened for a whole host of commonly co-occurring medical conditions, gastrointestinal disorders being front and center, but also an increased risk of seizure disorder. And in many studies, immune system dysfunction and immune system anomalies that also potentially could be treated if identified early. And I think clinically speaking, in my experience, I'm also a clinician, practicing psychiatrist. I treat individuals with autism and people with neuroimmune disorders. I think from a clinical perspective, identifying immune system anomalies early could potentially offer avenues of treatment, especially for those who have regressive features, people who've lost skills or lost language. So I think we need more education. And then I think there are things that we could be doing at a federal level within different federal guidelines and federal programs to clinicians to review certain aspects of someone's medical history and medical care to screen for these conditions. And
Mhm.
Wendy, I've had many experiences like yourself where people with very disabling gastrointestinal conditions, pain, horrific constipation, go to top tier medical centers and are told that's just autism and that's just behavioral and they're
Mhm.
not offered treatment. I think that's happening less than it was 15 years ago, but I do believe that it's still happening. I've heard that from members of our community. So, and then of course the next thing is, well, what do we do about those underlying
Right.
gastrointestinal issues? And here I think we really have to consider both a range of traditional treatments, but also really starting to think outside the box and really prioritizing diet, potentially certain, nutraceuticals that might be helpful for certain individuals in certain cases. I think one of the most exciting parts of autism research over the past few years has been fecal microbiota transplant therapies, which are shifting the microbiome. And, small studies have shown remarkable success. So I'm hoping that we can really move forward there and kind of fast track that avenue of research.
That is exciting and something that's been touched on for quite a long time. There were some doctors who were starting to do some of that, the fecal transplant work. People don't seem to have a stomach for it, but it's really about repopulating the GI tract, is it not? And making it healthy again, right?
Shifting the composition of the microbiome to make it more
Mhm.
diverse
Yeah,
and to decrease hypothetically pathogenic species and improve those species that promote health. I think
yeah.
we're in our infancy of understanding the microbiome, but certainly the fecal microbiota transplant studies have shown really positive signals.
Which is exciting because there are so many of our kids with autism who are suffering from very debilitating GI symptoms. And even, I find myself disappointed in mainstream medicine because they don't even address diet and how important dietary intervention, how effective dietary interventions can be. So we're going back to just, when we're comparing 2006 to 2026, right? I mean, all the autism moms were saying, gluten and casein-free diet really helped my kid, or specific carbohydrate diet really helped my kids. But the doctors weren't coming along with us. Like, that's bunk, right? But we knew and we saw what was happening in our houses.
Yeah.
It's like we need the doctors that are treating our kids to catch up to what we're seeing.
Yeah.
And what I'm happy to see is that there is quite a bit of research on the nutritional side.
I mean, look, I think some of the data around gluten casein-free diets has been mixed, but here too, I think we see a fundamental problem in some of the ways that autism research has been conducted thus far, because many studies are based, simply on someone having the diagnosis of autism. And we know that someone who carries that diagnosis can be vastly different in terms of their level of functioning, their support needs, their co-occurring medical conditions than someone else who has the same diagnosis. And so I think our clinical trials really need to be targeted towards specific cohorts, looking at gluten and casein-free diets in individuals who already have pre-existing gastrointestinal symptoms, for example, instead of all comers, right? Anyone with a
Right.
diagnosis.
Because that dilutes the research, that dilutes the findings, right? If they don't
Exactly.
have the issue, they shouldn't be in the study just because they have an autism diagnosis.
Right.
Okay.
And, just because there's an increased risk of, gastrointestinal disorders in autism in general doesn't mean that every single person is going to have that presentation, nor does it mean that every person is going to respond to a potential intervention. But if we identify subsets of people who may respond, and this is a very low risk intervention, some mainstream doctors and nutritionists worry that you are further restricting a diet that might already be restricted and decreasing exposure to certain kinds of nutrients. I think that's a very workable situation and scenario. And for those kids who respond, I think parents and families deserve an option to try something that might help them, that is essentially really in the short term, very low risk. Yeah, but I guess my main point is that the way we conduct research has not really prioritized meaningful cohorts or meaningful subgroups within the autism spectrum, and we definitely need that going forward.
Right, because we have this umbrella diagnosis of autism that incorporates the full spectrum and individuals who are completely different as far as the symptoms, the struggles that they're having, and the biological underpinnings of their bodies, right? So, how do you think how do you think we should go about getting to the point where we are doing cohort-based studies?
Well, I think probably the easiest thing to do going forward is to at least cohort people on their level of support need, what in years past we might have called their level of severity. So those with level 3 autism who are likely to be non-speaking or minimally speaking, who are likely to require 24/7 care. The term profound autism has been used in recent years to refer to this cohort of people. They, according to the CDC, represent about 26% of the autism population, so 1/4, but they are vastly underrepresented in research, maybe getting 5-6% of sort of research studies and research funding. So I think that is like a kind of a low-hanging fruit that we can kind of go after, that these people have been underrepresented in research. We have some catch up to do. And we know that individuals with level 3 autism or more profound presentations tend to also have higher rates of co-occurring medical conditions like seizures, like gastrointestinal disorders, higher rates of immune system dysregulation, So I think we have a lot of work to do to really begin to understand and investigate potential treatments for that particular cohort. And then I also think there are interesting approaches really just on the horizon utilizing biomarkers, not only sort of blood-based biomarkers that could look at immune profiles, cytokine profiles, markers for mitochondrial functioning, but also very interesting research over the past few years identifying movement differences and autonomic nervous system differences in people with autism that we could be using biomarkers based on observations and evaluations of movement. And I think AI could be helpful here, but also biomarkers like heart rate variability, circadian rhythm cycles, that kind of thing. So, what I hope we can move away from in the years ahead is move away from sort of nice to know research versus need to know
Need to know.
research. We need to focus on need to know research that truly improves the daily lives and quality of life of individuals with autism. And they're, most specifically focusing on co-occurring conditions, but also the more disabling aspects of core autism symptoms. So for example, studying animal models of the way animals develop vocalization as a potential parallel to how humans develop speech. Like that to me is not translatable into
No.
like improvements for our community. And I think we really, as I've said, I'll probably keep saying it over and over again, we need to prioritize translation into treatment.
I'd love to see a better use of research dollars. And also if you're thinking sort of from a triage point of view, the kids that do have what we refer to as profound autism are suffering on a daily basis. Their families are suffering every single day. A lot of them can't leave the house. A lot of moms and dads, mostly moms, feel imprisoned because they're the only person who can take care of their kid. And there are so many days when they can't go to school. The kids can't go to school. They can't leave the home. They're sick a lot. Their behaviors are out of control, but a lot of times that's because they're not feeling well, where they might be in a seizure cycle. They might have a seizure coming on. My daughter broke her caregiver's windshield last week, and we were like, "What?" She just snapped in the car and kicked through the windshield. And so unlike her, but absolute out of control and out of the blue, out of nowhere, because she had a seizure coming and that night, it hit her. But like this, it's this underlying stuff that affects these behaviors. So if you see a behavior like that, you see somebody kicking a windshield, breaking a windshield, you're gonna think, wow, that she is out of control, right? Well, yeah, she was out of it. Her body was not, she didn't want to break the windshield. Her brain wasn't functioning, right? She was out of control. And that's why you see those behaviors. But when you're dealing with those kinds of behaviors unexpectedly, and you don't know when it's going to happen, right? So for the families, you get into constant daily fight or flight mode as a caregiver. And so, yes, the person with autism is suffering physically and mentally. You mentioned a little bit about the motor planning and that kind of thing, like how the underlying medical issues that our kids have affect their motor skills and their motor planning skills. And a lot of times those behaviors are just completely out of their control. So when you're trying to care for somebody who has those types of unexpected issues, it's really exhausting. And you run into the safety issues, you get the burnout issues for the families and the caregivers. You have, I feel, a real gap in care when it comes to providing help for people with profound autism and their families, because these are the ones who really need a lot of support. like around the clock care, eyeballs on all the time. We have 24/7 care for my daughter. And I'm paying for a lot of that out of pocket because I can't get it funded, but yet I need it. I can't do it myself.
Yeah.
So so even as our kids become adults, my daughter is 26 now, like there's just not enough help there. So let's talk about, we're covering a few of the gaps, but let's talk about how IAC can help with recommendations. So I want to first explain, um, for people who don't know, what the Interagency Autism Coordinating Committee is and what it can do and what it cannot do, because people need to understand the duties of that committee, but also the lack of control that you do have. You can make recommendations and that's it. So can you explain how IAC works?
Yeah, sure. I first just, Wendy, if I can just go back and say I'm sorry that happened to your daughter and to you.
Yeah. She
Um,
didn't get hurt. Thank God. Nobody got hurt, but thank you.
yeah, and that's a story I've heard over and over again. And I think a recognition of the real day-to-day abject suffering that brings caregivers and families to their needs, in addition to the suffering of the individual with autism, feeling like their level of dysregulation makes it hard to be in their body, self-injurious conditions, pain, likely many report neuropsychiatric symptoms like intense OCD and anxiety and brain fog. The day-to-day challenges are real. We know that individuals with autism have higher rates of depression, anxiety, and suicidal thinking. The same is true for their parents and caregivers. And
Mhm.
you're right, it's because of chronic daily caregiving stress and severe states of fight or flight and feeling like every day you're walking on eggshells, right? Is my
Mhm.
kid going to feel okay today? And am I going to have to watch them screaming in pain? Um, are they going to have an incident or a behavior? Even a trip to the grocery store is an incredibly stressful event. I know for my son is 17, his name is Theo. He has profound, minimally speaking autism. He has struggles with a lot of dysregulation, so he jumps a lot, he's vocalizing, and we go to the grocery store and first it's scary to other people. He can get a little too close, he's a little too loud. For a while, he was very attracted to people who had bald heads, so he would walk over to them and try to sniff them.
Yeah.
I like to try to view it through a little bit through the lens of humor because without the humor, it's pretty heavy. Um, but all of that is to say, even a trip to the grocery store is a really stressful experience for families.
Right.
Um, in terms shifting to what the IACC can and can't do, you're right. We are a federal advisory committee. We have statutory authority, most recently from the Autism Cares Act of 2024. And that statutory authority relates to prevention, treatment, lifespan issues, communication, supports, housing. So it's a really broad mandate for the committee to consider. We can make recommendations to HHS, and those recommendations can be adopted or not. What I think is unique about this moment in history is two things. One is that the vast majority of the current 20 public members on the IACC includes real lived experience with autism. I think we have 13 parents of individuals with autism. We have 3 individuals with autism, including 2 non-speakers who type to communicate, which is incredibly exciting for the committee to have their voice present on the committee. Um, I think relatedly, getting back to the last thing we were talking about, I think as a community, and certainly potentially the IACC in years past, has focused more on highlighting the gifts and talents of certain portions of the autism community, And rightfully so, the needs for appropriate inclusion and workplace supports and community supports. And that is all true. And we can honor the inherent dignity of every person with autism and at the same time recognize that 1/4 of people with autism have such profound needs that they don't have independence, that they have daily suffering, and that they require 24/7 support often for the rest of their lives. It's
Mhm.
caregiving that doesn't go away, which I know you resonate with as the parent of a 26-year-old
Yep.
daughter, right? And I'm sure on your mind also is what's on my mind. What happens when I'm gone? Who's going to provide this level of intense care and support? So Anyway, getting back to the IACC, so we have a committee that is intensely focused on the real world, day-to-day needs of individuals with autism because most of us are either parents or caregivers or individuals ourselves. Um, and also, we have, I think, an HHS secretary who has made autism a priority. And I think that I'm aware that within the autism community, there are very mixed feelings about our current political situation. But
Right.
I think, in particular, Secretary Kennedy has been a champion for people with autism, particularly those who have the highest support needs and who have profound disability. So I think there's a difference as well. Autism deserves to cross political lines and cross political parties. Our kids do not deserve to be political pawns. And I think this is like an easy area to come together to find common ground, to set aside our other political differences and say, we are going to make a difference for these kids. Again, many of whom are suffering in ways that most people cannot even imagine.
No, they can't. And in the past, I have been to a lot of IAC meetings over the years. And in the past, we have had, you know, moms and dads of profoundly affected kids get up during public comment and share, heart-wrenching stories of what their lives are like and what their child's lives are like. And they're so underrepresented at these meetings and in presenting public comment because most of us in that situation can't leave our children and we can't bring our kids to those meetings and they're not able to speak for themselves, right? So they weren't getting and haven't to date gotten the attention that they desperately need from IAC. What I've seen in the past from the IAC committee uh, is one letter that I'm aware of. I don't know if there was another one, but back in, I think starting in about 2010, NAA started bringing the wandering issue to IAC. Every meeting we were bringing it, because there were kids dying, and we knew that this isn't something that needs 20 years of research. This is something we can actually do something about right now by providing information to people. And so we thought this is a no-brainer, right? So we brought that in, gave IAC all of the information that we had compiled. Here are the needs. Here's how to fix it. We put it all on a silver platter and delivered it. And that was the very first meeting that IAC ever, or sorry, the very first letter of recommendation that IAC sent that I am aware of to the Secretary of HHS. And what happened then was absolutely nothing. So
Yeah.
I,
Aware of that letter. It was 2013, I believe, and it was a letter to the secretary around this very issue.
mhm.
Um, Wendy, I'm hopeful that if the current IACC um, delivers a similar letter to the
Mm,
secretary, that there will be action. I
I
think
hope
we
so.
do have more recognition and a commitment, I think a growing political commitment to autism across political parties. So I hope, my hope for the IACC as chair is that we use more of those kinds of letters for immediate feedback to HHS about and granular recommendations about what can be done on a range of topics. Of course, we operate as a full committee, and so our initiatives and our recommendations are voted on in public. So I
Right.
can't know what the IACC will do, but as chair, I definitely have specific issues I want to bring to the table right away.
What are the most important issues that you want to start with?
Wendy, I'm not going to outline them now,
Okay.
in part because unfortunately, there's been so much attack on current IACC members, and including from former members who um, have established a sort of alternative committee of their own. And unfortunately, it feels like my normal uh, personality would be to share and to be excited about different initiatives and endeavors and ideas. But, in this climate, it's been a little bit difficult to want to be open because of kind of, I think, sustained and judging from the media, coordinated kind of attack from a few people. So I'm going to
Yeah.
kind of keep our initiatives to ourselves, but I will say, I think we're going to have a great first meeting, and I think people are going to notice a difference between the way the IACC function has passed and
Yeah.
how it's functioned in the past, and again, the sense of urgency and lived experience that we bring as a new committee at this point.
That's what makes me so hopeful about this committee is that I know there will be a sense of urgency. And a lot of people that have been appointed have a tough skin. And so any media attacks or whatever politics should not come into play with any of this, but it will. But I think that this committee is strong enough to stay focused and keep going and try to make things better for our kids because it's been way too long that we've had a committee doing absolutely nothing and a secretary of HHS also doing nothing to support the recommendations. So I'm really hopeful for the first time that I just stopped. I mean, I just gave up on IAC. I just stopped going to the meetings because they weren't doing anything to help my kid, you know? And now I'm feeling really hopeful, like, hey, maybe we'll get somewhere in the next couple of years. And I do wish people would put the politics aside. I don't care if you like RFK or you don't like RFK. It's not about that. It's about helping our kids. And nothing, no treatment, no recommendations should be attacked simply because of who they're coming from. And that's what bothers me, you know, and I really need our kids to come first. I hope that we can get there. Please put our kids first. Like the
I,
media, members of the
I think
media,
we
come
have that
on.
by virtue of the incredible amount of lived experience on the committee, people who are dealing with this day in and day out. I
Yeah.
think there are at least 5 or 6 members of the committee who are supporting family members who are on the profound end of the spectrum. Like, we get it. I get it. I had periods of years where my son had such intense daily pain that he would scream for hours every day. And the only thing I could do was hold him, specialist after specialist, myself being a physician, like we for a long time were unable to help him until, and I wanted to sort of bring up and sprinkle in until we treated his immune system. So he ultimately has pediatric acute onset neuropsychiatric syndrome called PANS, which is essentially when the immune system gets activated, you get important inflammatory changes in the brain that can produce very specific symptoms. And chronic pain is one of those that can present in a subset of people with PANS. Once we treated his immune system with appropriate medication, he made a rapid recovery in terms of his pain syndrome, and his gastrointestinal issues improved markedly. Um, but there were years where it was so gut-wrenching. I like, even as I'm talking about it now, I can feel myself, getting a little bit tearful because um, the level of trauma, his trauma, our trauma, the powerlessness you feel at not being able to help your loved one. So I get the urgency, like, and I know the members on the committee that I know personally, and I know a few of them who also have supporting family members who are have level 3 autism and serious co-occurring medical conditions. We get it. We get
Hmm.
it. Um, and I feel that is potentially substantively different than makeups of previous committees.
Absolutely is. Yes. And we even got a lot of pushback on just the wandering issue. Even that was political. And we're not, this wasn't recent. This was a very long time ago. But pushback because of the politics of autism and because of the embracing neurodiversity and the gifts that come along with autism. And so we weren't allowed to say anything negative about it, and if we did, we were under attack. And so even when it came to safety issues like wandering and elopement and kids dying, we got pushback on that and accused of basically wanting to put locating devices on every single person with an autism diagnosis, and they're not going to have any personal freedom or autonomy anymore. And it's like, but wait a minute, like there's nothing, nobody said anything about that. It was,
Mm.
yeah, let's educate families, let's educate first responders who are dealing with search and rescues for kids, but it turned into a political thing. And like, how do we? I I don't know. I don't think you can answer that question. How do we stop it from? Can't we? How do we keep it about the kids?
Well, I think there is a way. I mean, I think previous versions of the committee and previous chairs of the committee could say very easily, this is your perspective as
Mhm.
someone who doesn't have 24/7 support needs. And your perspective should be honored, your needs honored, your hopes and dreams and your gifts and skills like honored with dignity, and that this is a totally different population and
Yes.
that you don't have experience with that population. You can't know their needs. I think as a leader of a committee or a chair, we can say that's fine that you think that. And we are going to prioritize and privilege the
Yeah.
needs of people who aren't represented in this room because their symptoms are so severe that they can't even make the trip or like get through security or be in this room for more than 5 minutes. So I actually don't I'm someone who tends to really, really work at cultivating empathy, but I do think we can't make, sort of concrete, illogical assertions when we're trying to help a very specific subcohort of autism. So
Yeah.
I'm getting a little riled up about that, but I think that's been incredibly unfortunate over the past, 2 decades, like mostly the past decade, where there's been this, I think, framing by some members of the autism community, again, those with the lowest support needs, that their viewpoints should sort of count across the spectrum. And I just think we have to just say that that's not valid and it's not accurate. Again, while supporting those needs and finding common ground. Like I want to find
Exactly.
common ground with those people. Like um, individuals with lower support needs still have support needs around housing, around workplace issues and workplace support, co-occurring conditions like anxiety, OCD, gastrointestinal issues. Like there's a lot of common ground. Let's stay focused on the common ground needs, and where the needs diverge, we need to have different policies and different initiatives.
Right. And everyone on the spectrum needs some level of support, right? And so I remember a conversation at the White House, a White House luncheon one day, where I was seated next to a self advocate. And we had a conversation. And I said, I would be so grateful if my daughter could do what you do. But my daughter is so profoundly affected. And let me tell you about what a day is like in my house. This is what goes on. And I said, I get that you have challenges and I get that you need help with housing and you need help with employment. And I am fully ready to stand beside you and fight for every single thing that you need because you deserve that help. I also need you to help me and my daughter and families like ours, and don't fight against us on the things that we really need. And it just never came together. It still hasn't come together. So I hope that we see changes coming, and I am very hopeful that we will see some changes with this committee. And I'm so excited that you're the one who's leading the way, Dr. Fogel, because I think you have the right temperament for it. You have such a thorough understanding of autism, the whole spectrum, and you know how to get people together and get them talking and to be productive. So we're really NAA as an organization is actually very happy that you're leading the way on IAC, and we really look forward to seeing what all gets accomplished here. When is your first meeting? Because I understand there's been some delays.
There has been a delay, and our first meeting is coming up soon. It's going to be officially announced in the next few days. I was hoping it was going to be announced last week.
Okay.
I've had a bit of an education about the pace of government
Hmm.
recently, which doesn't always work as quickly as, things happening, let's say, in my professional sphere, in the medical sphere, or in the private sector. Um, but anyway, there are lots of people working really hard to get that accomplished, and there's lots of also different steps and notices that need to happen. But it's coming, and it's in sight, and we have a date scheduled, and I'm gonna, defer to official channels for the
For
announcement of
them
that.
to
But I'm
announce that.
really, really excited. We're definitely working tirelessly. A number of people are doing a lot of preparatory and background research for this first meeting in
Hmm.
order to bring. I'm going to be bringing several initiatives to the full committee, and we're hoping we have definitive work products that first meeting. That's my hope.
Okay.
So I also wanted to just go back, Wendy, and just thank NAA for their incredible advocacy around safety and wandering and drowning, because I think there are a few different people working in this space, but yours has been a singular and consistent voice. And thank you for doing that advocacy and for bringing these concerns to at the federal level, including to the IACC for so many years. On a personal level, the safety issue seems incredibly important to me. I have digital locks on all my doors. My son has
Hmm.
wandered several times. We had locks, on windows. Luckily, we don't need them anymore now that he's older. He's 17. But, I understand this issue. And my heart aches for the many, many parents who've had a wandering issue that has resulted in death. I mean,
Yeah.
I, um, there are no words. So, and we can prevent this. And I know from my
Hmm.
own experience, both as like a patient with my son, but also as a professional, the safety issue is not front and center the way it needs to be. If you are diagnosed with type 1 diabetes, you go home with a whole safety plan about what happens if your blood sugar gets too low. Always carry, a glucose pack or candy or whatever. Like, this is when you should call 911. Like, you're given a whole, same thing with asthma, right?
Yeah.
This is how you should measure your symptoms. This is when you should go to the hospital. Like, you're right. Like, education can really start with initial visits around diagnosis or follow-up visits with pediatricians, educating on simple adjunctive safety tools that
Yeah.
may not prevent every single case, but can sort of reduce um, a lot of the wandering and related death incidents. So I want to thank NAA for doing that for so many years and for sticking with it, even when you felt like you were falling on deaf ears, because that's not the case anymore.
Yeah,
I
I'm
hear
happy to
you.
hear that. I'm happy to hear that. A lot of work went into putting together, informational materials and on wandering and elopement. And our co-founder Lori McElwain and I worked nonstop on that issue for many years. So I'm really, I'm hoping that we can get something done through. I'm hoping maybe CDC gets involved. I don't know how it would work technically. But I would love to see safety issues be addressed like immediately when somebody is diagnosed with autism because it is so common and so preventable. I mean, these kids are dying. These are all preventable deaths, right? But there's some basic stuff that parents need to know, how to avoid triggers, knowing what your child's triggers are, how to make your home safe as possible, how to address school elopements. That happens a lot. I mean, Kevin and Avante's law, that came from, Avante Aquendo, who eloped from school. So it's not just home environments, but I would love to see IA kind of push that forward as a recommendation at some point to HHS, like, hey, we got to provide information just like you do with a packet for diabetes. We need to address this safety issue because this is easy. This is an easy one. This isn't one that anybody has to argue about. And it's
Yeah.
pretty basic information, get it out.
Yep.
So I look forward to something on that. I hope we see that soon. And I'm looking forward to your first meeting, Sylvia. So Sylvia, recently autism was in the news on a huge basis when President Trump and Robert F. Kennedy Jr. had a press conference at the White House. There was discussion about autism. There was discussion about Tylenol. There was discussion about leucovorin. And it really sort of set the autism community alight with people who were a little upset. We had people who were really hopeful because they hadn't heard of leucovorin before. But what I was happy to see was that autism was getting some national attention again after really kind of being under the radar for several years. It wasn't getting as much attention. And with so many people affected, we really need that attention to be on autism. So can you talk a little bit about that particular press conference, what that spurred, and what were the results so far, and what do you think is going to happen in the future based on that?
Yeah, thanks for that question. So, first, I think you're right that bringing more attention to autism and attempts to highlight the disabling aspects of autism in particular are crucial. And, I'll collaborate and work with anyone who wants to bring attention to our community. I think there was a lot of pushback against the acetaminophen and leucovorin announcements. Some of it, I think, was political. But I also think that the announcements could have done a better job really explaining the mechanism of risk with acetaminophen and also the mechanism of action of leucovorin. And I think in general, we need to really be focusing on mechanisms, cellular, subcellular, systems level biological mechanisms to investigate and also to explain a number of environmental risk factors and also our treatments. So, for example, we know that there's been very good research from Phil Landrigan, who used to be at Mount Sinai and is now up in the Boston area, and epidemiological researchers showing that, organophosphate pesticides are associated with neurodevelopmental disorders more broadly, not autism in particular, but neurodevelopmental disorders. What's missing and what's siloed in different research is then how that affects the metabolic functioning of the cell, how that impacts development. And so information is siloed. So with respect to acetaminophen, I really like to understand potential environmental risk factors in terms of a model developed by my colleague Laura Cellini at our group called the Autism Innovation Coalition, AIC. And Laura developed a kind of this simplified model of very complex biology, but it goes something like this. There are primers that set the stage for autism and other chronic medical conditions. There are triggers which get the acute pathophysiologic issues or pathophysiology like going. The illness starts or the regression happens in the case of autism, let's say. And then you have amplifiers. So conditions within the body or in the family system or in the community that prevent resolution and healing. And so I think about acetaminophen in this model of primers, triggers, and amplifiers, and really see it like other environmental contributors as a potential primer. We know that acetaminophen decreases the production of glutathione, the body's main antioxidant, and what helps keep redox status or oxidative stress status of a cell intact. It's also like really important for detoxification. There's also incredible data showing, we know it's widely accepted that acetaminophen can cause liver failure at toxic doses, which frankly are not that far away or not far away enough from therapeutic doses. Lots of people get liver damage from acetaminophen. But there's really interesting research by William Parker, who's a visiting scholar at University of North Carolina, Chapel Hill, and others, showing that the doses required for liver damage are far higher than those that might be required to damage fragile neurons, especially during vulnerable periods in development. So the acetaminophen story is complicated. Is one or two doses of acetaminophen in pregnancy going to cause autism? No, I don't think anyone thinks that, right? And I don't think anyone thinks that autism causation is any one thing. It's almost certainly pluricausal. But the question then becomes, what are the pre-existing genetic vulnerabilities around detoxification or synaptic pruning or other aspects of development in that unique person? Does the mom also have maternal immune activation or an autoimmune disorder herself? What's the nutritional status in that pregnancy or in that postnatal period? And so when we have something that we know causes known and well-characterized disturbances at the level of cellular functioning, we should take that seriously. Of course, it's not just one thing, but if you've identified, an iatrogenic medical intervention, acetaminophen, that potentially raises the risk of harm, we should at least be using it more thoughtfully. I was a birth partner for a friend of mine who gave birth in a New York hospital. And during the transition period of labor, she had a labor induced with Pitocin. And during the transition period, she developed chills and shakes. She was given 1,000 milligrams IV of acetaminophen, which is very common practice in, obstetrics wards. As soon as that cord is clamped, right, that baby does not have nearly the same liver capacity and detox capacity to detoxify that acetaminophen. And again, knowing what we know now through animal models, that the impact on the brain occurs at far lower doses than what you would expect for liver damage, I think just the precautionary principle, like, can we get back to the precautionary principle, right? Recognize that this wide scale, very helpful intervention for a lot of people, especially those suffering, with pain, might have effects that we don't anticipate. And, I think we see like a similar example. It's not a perfect parallel, but, antibiotics have been like life-saving interventions. They're a backbone of modern medicine and treatment of infectious disease. And yet we know early antibiotics increases the risk of obesity and metabolic dyscontrol and changes the microbiome. And we have all these like cascading longer term off-target effects that we need to consider. I think the same should be true for acetaminophen. I think we have to not overstate when we identify risks, and we also need to explain what the issue is at the cellular, subcellular, and body systems level. The American public is capable of understanding this. Like, we don't need to dumb it down.
Yeah, I think you're right. I don't think that information was presented as well as it could be. And I'm not sure that that's even possible during a press conference, but I do wish that it had been delivered in a way that didn't cause so much distress and division, because it's important information to have for a lot of people who are unaware. Not only the acetaminophen part of it, but also the discussion about leucovorin.
Yeah, that I also
Um,
felt was so disappointing. So, yes, the clinical trials for leucovorin have been fairly small. And yes, we can hope for, and demand better data. But
mhm,
this is an intervention with incredibly low risks. And Risperdal was licensed based on a handful of studies that encompassed maybe roughly 200 and 250 kids. Risperdal is an antipsychotic that's frequently used in autism. It's FDA approved for irritability in autism, not for core symptoms, but it's frequently used for behavioral control and management in autism care. So the trials that led to the licensure of Risperdal were also, they weren't thousands of individual children.
mhm,
And we know that Risperdal in particular has risks that you don't see with leucovorin. Um,
right,
Movement disorders in particular, metabolic dyscontrol, obesity, gynecomastia, increased prolactin levels. Like there are a lot of risks associated with Risperdal. It helps a lot of people, right? But just always weighing risk benefit. The risks of leucovorin are very minimal. Maybe an increase in irritability. Some kids might experience a little bit of insomnia, maybe. Um,
right,
uh, some kids tend to get activated with it. But for kids who you suspect folate receptor autoantibodies, or for you who've tested, they have folate autoreceptor antibodies, which seem to be a marker for depressed levels of central nervous system folate, these antibodies, we have so few treatments to offer, you
mhm,
know, and instead of like, okay, this is interesting. We don't have data to make this as a universal recommendation. We need more adaptive clinical trials studying this in specific cohorts. And at the same time, if you have nothing else to offer a patient, like this is a reasonable thing to try,
yes,
like appropriate medical supervision.
right,
And instead, families are getting letters from top tier autism medical treatment centers saying there's not enough evidence for us to recommend this. I, we use off label treatments all the time in lots of medical settings. If there's something that potentially can help someone, help a child speak, get more language, have better social interaction and connectedness, which have been found in the clinical trials that exist. And it's low risk.
mhm,
And I get there are some people who say, look, the trials are using, doses of folinic acid that are, orders of magnitude above what you would typically see physiologically. And we don't know what the long-term impact of that is. I get that. I
mhm,
agree with it.
yeah,
And we know what the long-term impact of Risperdal is.
yeah,
It's
we do.
potentially tardive dyskinesia and a movement disorder and
Mhm.
weight gain, insulin resistance,
Mastectomies for boys,
right?
yeah,
So
those kind of things, yeah,
I just feel like we just need to have a little bit more humility and a little bit more like going back to the art of medicine, especially around conditions like autism, which are so heterogeneous, so variable between people, and for which we don't have like really good mechanistic understanding of what's happening. And if things are low risk, like dietary interventions or
yeah,
folinic acid, like let's open ourselves up again with humility and with appropriate medical care, right? And just
right.
say, these are things that might be reasonable to explore.
At least take a look. Let's take a look. Leucovorin is, for people who don't know, it's a drug that has been FDA approved for over 80 years. It's a established safe medication. So if a doctor wants to do a trial for your child with, agrees to, hey, let's give this a whirl. Let's see if this helps your child feel better. That to me, I mean, you're always weighing the risks and the benefits of everything that we do. For us, that was like a no-brainer. And we went ahead and did that many years ago. But thanks for explaining, both of those issues and the way it was presented at the time. I think no matter what comes out of the White House at this point is going to be instantaneously attacked. However, there was some good information that came out of that has now helped. Luke of Warren, I mean, a lot of parents didn't know anything about it. And now there's so many people saying, wow, this has drastically helped my child.
What's been really
It's
interesting too, I
great.
want to make an additional point about Luke of Warren, is that when it was covered in some media articles, um, certain autism experts were asked about Luke of
Mhm.
Warren. There was in particular, I saw comments from two different psychologists who are not medical doctors. Um, Comment that, along the lines of like, this makes no sense and is absurd and isn't been proven, hasn't been proven. And I think to myself, these are people who haven't studied basic biochemistry. They don't know the folate pathway inside the cell. They
Mhm.
likely aren't familiar with the research over the past, I would say, close to 15 years now, looking at autoantibodies to the folate receptors that regulate the passage of folate from the peripheral in the blood, the peripheral part of the body in the blood, to the central nervous system. They likely don't even understand that physiology and why, even from a hypothetical perspective, it might be helpful. The folate pathway inside a cell goes on to regulate a whole host of cellular functions, including DNA methylation. So going back to this understanding the system's biology, like we really need to understand this framework at that individuals with autism, we now have really robust data across many studies that there is mitochondrial dysfunction, oxidative stress, very important immune system changes, gastrointestinal function changes, microbiome changes, changes with autonomic nervous system functioning, movement disorders. This is a whole body disorder. This isn't just
Yes.
something that affects the brain. And we need to be prepared to go back to basic biochemistry about how certain inputs, and this is where I think a lot of like focus on nutrition is so important. These are basic cellular building blocks, and folinic acid, leucovorin, is a form of folate that's, like really important, especially within the central nervous system. I think going back to basic cellular physiology and understanding how these cellular physiologic functions build to create systems level functioning um, is really important. And I think we need to understand potential and interventions from that viewpoint. And it's not how most of us as doctors are trained. We're
Yeah.
not trained to think about sort of root causes or underlying causes. I hope this is beginning to change, but the change isn't really coming from our medical institutions. It's coming from the populace who are really demanding nuanced, out of the box approaches to chronic health conditions.
You're right. And when you say autism is a whole body disorder, I literally got goosebumps because yes, it is. And so many people have been saying that for so long. But you're absolutely right. It is a whole body disorder. And we need to start looking at the whole body if we're going to help our kids. And also when you talked about prevention earlier, if we're ever going to lead to prevention and trying to get this prevalence of 1 in 31 to start going the other way, I mean, what we have to get to work here. We have a lot to do, and looking at autism as a whole body disorder is a really important part of that. So I think we kind of are ending up where we started, where we were talking about cohorts in autism and where the research needs to go and the different directions that it needs to take. And I am really happy that you, as the chairperson of the Interagency Autism Coordinating Committee, will have some direction and a way to make some really robust recommendations to HHS. I hope that that is what will be coming from your work. And I know how hard you are working, and we want to let you know how much we really appreciate it. Wish you all the best in your new position as chairperson and also at your first meeting that will be coming up soon. And just to clarify, because Sylvia, you said you didn't want to identify your like top three things that you wanted to do because you didn't want it to get out yet. But for everybody to understand, everything that IAC does is public on public record. So you will be able to watch live or attend all of the meetings live if you want to, or just watch the webcast. You can also submit public comment for each meeting if you want to do that. Please get involved with IAC. I think this is a committee that's going to hear you, and we haven't had one of those ever, maybe. So
I'd
good
like to
luck to
just
you.
emphasize that, Wendy, if I can. We really want to hear from all members of the autism spectrum, but particularly those who've been sidelined,
Yeah.
which I think are those parents and families and individuals on the more profound end of the spectrum. What I'm really also excited, so we want to hear from you. Please submit public comments. I know if you've done this in the past, if you submit public comments 15 years ago and you feel like it didn't help, we need to educate our whole population about the needs of those, particularly with the highest support needs and the highest disabling symptoms. So I really want to hear from those members of our community, again, all the community, but particularly those who've been underrepresented in research and policy decisions. Um, and we want to listen. My hope is that we will, outside of just regularly scheduled meetings, be able to hold some public listening sessions virtually so that people will have, those are some initiatives I want to bring up at the first meeting. We want this to be a dynamic, active committee. We, as many of us affected by autism, understand this journey, and we want to get to work and take action. So I really encourage people to submit public comments and to get involved.
Thank you so much for that, Dr. Fogel, and thank you for talking to us this autism um, April autism. I don't like to say autism awareness month. I just don't like if we're not aware at this point, um, to say autism month is here or
Autism
upon
Advocacy
us.
Month.
Advocacy. Yeah, I like that better. I less I just like that our kids are going to be getting some attention, and their needs are going to hopefully get focused on in a productive way. And I again want to thank you not only for chairing IAC, but also for joining us today to talk to everybody, the whole community about what's the state of autism now in 2026. Where are we headed? And thank you.
Thank you for having me. I appreciate it.
It's absolutely wonderful. We hope to talk to you again soon.
Absolutely. It would be my pleasure.